With more than 6,000 small and micro-cap companies listed, if you're looking for the next apple at the earliest stage, then Channel Check truly is the orchard. The listed companies support Channel Check, so it's free for you, the potential investor, to gain access to institutional quality research from FINRA licensed analysts, advanced market data, industry reports, news, and a growing catalog of videos and webcasts. Make sure to subscribe to our YouTube channel and register for Channel Check so you're always up to date on what's going on at the small and microcap data place. Welcome to New Methods in Pain Management, a NobleCon online investor event, presented by Channel Check and Noble Capital Markets. Noble is an SEC-registered, FINRA-licensed broker-dealer and the source of the equity research available on Channel Check. This presentation features Heron Therapeutics, NASDAQ ticker symbol HRTX. Following a brief overview presentation from CEO Barry Quart, he is joined by President John Poyhonen and Noble Research Analyst Gregory Aurand for a Q&A session. And with that, I am pleased to present Barry Quart.
I'll start with a 10,000-foot view of Heron Therapeutics. I'm Barry Quart, the Chief Executive Officer and Chairman. We have 3 marketed products, 2 focused on chemotherapy-induced nausea and vomiting, 1 which is the primary discussion topic for today, which is Zynrelef for postoperative pain. And we have another product that we'll be filing late this year for postoperative nausea and vomiting, and 1 product in development. We recently had a highly successful meeting with the FDA regarding the labeling for Zynrelef, and have already submitted a supplemental NDA that's designed to expand the indication statement, which is now shown here. So for postoperative analgesia up to 72 hours after foot and ankle, small to medium open abdominal, and lower extremity total joint arthroplasty surgical procedures. So this is a significant expansion of our label, assuming it's approved. We also reached agreement with the FDA for a second supplemental NDA, which would be planned for the second half of next year. We'll be generating data in order to support the second SNDA, and that filing would be designed to cover all 14 million target procedures for this product. Why are we so focused on postoperative pain? Because you have 50 million patients a year in the United States. 67% of them get opiates, which leads to greater than 2 million Americans becoming persistent opiate users. And with over 90,000 deaths last year due to opiate overdose, this is a very significant issue in this country. Our goal is to reduce the amount of opiates that are used after surgery and hopefully eliminate the need for opiates to go home after surgery. This is our current indication statement and limitation of use. And I just wanted to point out there's numerous aspects of the package insert that are unique and important. The Zynrelef is the first and only local anesthetic to be classified as an extended release product based on superiority to bupivacaine over 72 hours. The agency recognized Zynrelef's unique mechanism of action, which allows it to be superior to bupivacaine, not only in the over 72 hours, but in the first 24 hours, as well as in the first 48 and full 72 hours. It is the only dual-acting extended release local anesthetic, and as I mentioned, having shown superiority to bupivacaine, and we're very pleased that we were able to get our study versus placebo and bupivacaine in total knee arthroplasty in the label. We have a very impressive label compared to some of the other products that have recently been approved. And I'll take most of the time today to discuss the data with Zynrelef. We did two very similarly designed phase 3 trials, EPIC 1 and EPIC 2. EPIC 1 was in bunionectomy. This was a randomized controlled comparative study versus placebo and bupivacaine hydrochloride, the standard of care. The pain curves are shown here, and you can see in the top three curves that there's a significant separation in terms of lower pain with the Zynrelef arm compared to bupivacaine or placebo. We did a follow-on study after the completion of EPIC 1, where we also gave patients Tylenol and Advil, so just over-the-counter analgesics, and that is the curve at the bottom. So a multimodal approach to pain management with Zynrelef as the cornerstone of that therapy resulted in patients after this very painful surgery having only mild pain over the 72 hours. Same kind of picture in our EPIC 2 hernia repair study. Again, good separation with Zynrelef over 72 hours in the pivotal trial. And then with a multimodal approach, very low pain scores through 72 hours. Now, when you reduce pain significantly, as expected, we significantly reduce opiate use as well. And here we're looking at the amount of opiates that are consumed over 72 hours. Again, significant reductions with Zynrelef in the pivotal trials, but really quite surprisingly large reduction with Zynrelef in the follow-on studies. And that follows very nicely with the reduction in pain in those studies. And if you reduce opiate use to that extent, not surprising, you see a very large increase in opiate-free patients. So these are patients who took no opiates during the 72 hours. And in fact, on the left side, in our EPIC 1 bunionectomy study, you can see a significant increase in opiate-free patients. And in the follow-on study, you had 77% of patients opiate-free, and they remained opiate-free through 28 days. Similar picture on the right with hernia repair. Very substantial number of patients in the randomized study, but 91% with a multimodal approach, with almost all of those remaining opiate-free through 28 days. With TKA, this was our pivotal trial. Again, the regulatory studies, patients received no other analgesics other than rescue meds, but we showed significant benefit in the TKA model. But with a multimodal approach, which is the standard of care for patients receiving a TKA procedure, you can see we're able to keep, again, the pain scores in the mild pain range through 72 hours. And based on that data, we believe Zynrelef will be a dominant player in the TKA market, which is over 1 million procedures a year. We've been able to publish all of our pivotal trials and a substantial amount of the follow-on studies in the last 2 years. And then switching now to the commercialization of Zynrelef, this just summarizes some of the really unprecedented value that we believe Zynrelef brings to the market. In terms of the current labeled procedures, that's a little over 2 million procedures, and in that setting, we bring very significant value in terms of reduction of cost versus Exparel, and as I showed, a very significant clinical benefit. As noted, Zynrelef is the first and only extended release dual-acting local anesthetic, keeping more patients out of severe pain and opiate-free for 72 hours after surgery. Market research at the time of launch showed a very high scores in terms of comparison of Zynrelef versus the competitors. And this is just a snapshot of the patient populations that we'll be going after. The first row are the current indicated procedures. The second would be the group that we would be trying to expand the label to in the recently filed SNDA. So where are the patients? The patients are predominantly in the hospital now, with a majority of patients in the current COVID environment moving into the outpatient hospital setting, with an important number of patients in the ambulatory surgical centers as well. In fact, 54% of our patients have the opportunity for favorable reimbursement in the outpatient or ambulatory surgical centers, and the vast majority of the 2.1 million patients are in those settings. So looking at reimbursement, in terms of Medicare, we have filed for a C code. That C code is still under review. While that review is underway, the product can still be reimbursed at 95% of AWP. And what I also want to point out is just as important, if not more, in the very short time since we've launched the product, we have greater than 86 million lives covered by commercial and Medicaid payers. In the ASC environment, also many of them are in the outpatient hospital environment. So this is a product that is going to have wide reimbursement, both eventually with a C code for Medicare and commercial payers. And looking at the pricing, the top tables show our launch price for Zynrelef versus Exparel's current price. The second table shows the reduction versus Exparel in the 340B setting, where we offer a 340B discount. Looking at the large vial, we have a 41% discount versus Exparel in that 340B setting, 46% reduction with the smaller vial. And then the bottom table shows the economic advantage with pass-through of using Zynrelef versus using Exparel in the 340B setting or in the hospital outpatient setting. And in the 340B accounts, because of the pass-through that we anticipate receiving and currently receiving through a miscellaneous C code, it's about a $415 difference in terms of a profit to the facility versus an out-of-pocket cost. Looking at our marketing approach, our target audience in terms of the initial launch phase is shown here. We've done a significant job of evaluating our target hospitals and IDNs, and have identified those that are fast acting and kind of medium speed, the green and yellow facilities that have indicated they can put the product through a P&T committee relatively quickly. And this is really the sweet spot of identifying fast acting facilities that are also 340B, that are using Exparel, and that's our initial target opportunity. So what do we think is the potential for a product in this marketplace? And just trying to kind of give some bookends in terms of what investors can expect. As you can see, first quarter for Exparel And then we put on this graphic Endexo, which because of stocking had really the fastest launch we could find in a hospital product and in the first 6 quarters. And then Affirmav, another ultimately successful product in this marketplace. And obviously our target is to be as good or better than Exparel, although we're obviously launching into a COVID environment where elective surgeries are significantly down. To very quickly show you the important safety information, Zynrelef contains a small amount of meloxicam, which is an NSAID, which requires us to have a box warning for NSAIDs. Now switching to our CINV franchise. The CINV franchise has been growing slowly over this year. In the last quarter, units increased 22% for Cymvanti, our NK1, and increased substantially 108% over a low starting position for Sustol, which was relaunched at the beginning of this year. However, we want to point out we have significant headwinds in this marketplace. Because of COVID, we're seeing 25+% reductions in patients starting chemo, in patients coming in for assessment to oncology practices. So obviously it makes it hard to grow a product when the market is contracting. We're also seeing a large shift to value-based care and reimbursement, which has significant headwinds versus premium price products. And last but not least, we have a competitor for Sustol, IV Akynzeo, which is doing better than we expected this year in terms of keeping its ASP up. I will point out on the last slide, we anticipate that third quarter versus second quarter will grow 5 to 10%. And again, this just highlights the issues in terms of reductions of patients coming through clinics, which is a significant issue and reductions of all 5-HT3s and NK1s are down. As I already mentioned, Akynzeo is a much stronger competitor this year than expected. So here's the picture in terms of overall sales of the CINV portfolio. You can see the good growth in Sustol, again, starting from a low base, and continued growth of Cymvanti in the last quarter. And again, this just highlights the Sustol specifically. An important product is not as well recognized as we think it certainly deserves in our portfolio is HTX-019 for postoperative nausea and vomiting. PONV market is about 20 times the size of CINV, and HTX-019 has the potential to really be the best-in-class product in this marketplace. We have an active IND. We've already done the bioequivalence work necessary to file this product as a 505(b)(2), and plan on filing at the end of this year. We think this could be a several $100 million a year opportunity. And this just shows the massive difference between aprepitant and the current standard of care, ondansetron, for PONV. With the dramatic difference in numbers of patients vomiting after surgery of ondansetron in the lower curve versus the 2 doses of aprepitant. This just highlights the large numbers of patients who are at risk for PONV, and the surprisingly high percentage of patients that would be qualified as high risk. And there's also about 5 million procedures a year where the patient would be at high risk of damage to the surgical procedure. from having vomiting or retching after surgery. So these are really our target initial market, high-risk patients and patients receiving high-risk procedures. And as I noted, we think that HTX 019 is really the ideal product. It's the ideal product in terms of substantial efficacy and really recognized in the marketplace as the most effective agent, prepotent for postoperative nausea and vomiting. It's a perfect match to our target market for Zynrelef in terms of accounts and target audience. So once approved, there will be a seamless transition into the commercial space. And then last but not least, I'll leave you with a financial summary. We ended last quarter with $257 million in cash and another $42 million in accounts receivable, so a strong balance sheet. Thank you very much for your attention.
Hi, this is Greg Aurand, Senior Research Analyst at Noble Capital Markets. Thank you, Barry, for that excellent presentation and the overview on Heron Therapeutics pipeline and current commercialization of Zynrelef. I do have some follow-up questions, if you don't mind, regarding the product portfolio. Zynrelef is it's a dual mechanism product, is that correct? And can you discuss a little bit more about the unique mechanism of action and the benefits of that?
Absolutely. Thanks, Greg. It's a great question, and I didn't have time and a brief presentation to go into it. But what we found in the development of Zynrelef and the ultimate combining of bupivacaine and a small amount of meloxicam is that most extended release bupivacaine formulations start to lose activity by 24 hours. And you see substantial loss of activity on day 2, day 3. And it doesn't seem to matter whether it was a polymer, whether it was a liposomal formulation or some other means of extending the release. And what we found is that in the microenvironment of a surgical incision, not surprising, you get inflammation. And inflammation produces an acidic environment. And it's been well known for 30 years that local anesthetics, particularly bupivacaine, exist in a balance between ionized and unionized forms. And in order to get through the nerve membrane, the local anesthetic has to be unionized. And then once in the nerve, they then need to be ionized in turn to block the sodium channel. So if there's inflammation in that incision, reducing the pH, what we find is the pH actually drops 1 pH unit, which shifts the balance of unionized to where you have almost entirely ionized drug. Sorry. And with that almost entirely unionized local anesthetic, virtually none of it can get through the membrane. And so with these local extended release local anesthetics, the drug is there, but it's not getting through into the nerve. And if it can't get in, it can't work. So by adding a small amount of meloxicam, we reduce the local inflammation, we normalize the pH, and with that normalized pH, we allow the bupivacaine to actually do its job. And we allow it to do its job better than regular just bupivacaine by itself, which when we've looked at Zynrelef versus bupivacaine alone in the same formulation, same release profile, we beat the extended release bupivacaine at 24, 48, and 72 hours. And in fact, we beat regular bupivacaine at 8 hours with the same dose of Zynrelef. So it just really revs up the potency of bupivacaine by allowing more of it to get into the nerve.
No, that sounds excellent. Thank you for the explanation. I wasn't aware of how that actually worked. You mentioned, I think, in the presentation that it can be used in a multimodal regimen. Are there any limitations or interaction issues that might be involved if indeed they wanted to use other therapeutics?
No, in terms of multimodal approaches, the most common agents that patients receive in addition to the local anesthetic is, over the counter, whether it's Tylenol or Advil, or you can use a, prescription NSAID like celecoxib. There's no concerns about using an NSAID along with the Zynrelef. That's certainly permitted within the package insert. You just want to monitor the patients a little more closely because they're receiving a little extra NSAID. Aside from that, no reason to not use that combination. And as I showed, it works extraordinarily well in the hernia and bunion model and the TKA model, where we kept patients in the mild pain range for 72 hours.
Yeah, given the opioid use problem, this seems to be an effective countermeasure to that problem they were experiencing here. Can you walk us through the Zynrelef launch to date at this point, since it's relatively new in terms of just getting into the market?
I'll turn that over to John, but I just want to add one thing to the point you just made. We certainly have an opioid crisis in this country. A component of that, certainly not the whole issue, but a component of that are patients being exposed for the first time to opiates after surgery, and then patients going home with opiates, both for where they become persistent users, or 86% of opiates taken home end up in the medicine cabinet because patients don't use all of it. So one of our main focuses has been, how do we get patients out of the hospital more quickly with less pain and no opiates? And one of the studies that we've completed is the HOPE study, where we looking at open inguinal hernia, which is a very painful procedure. We're able to get over 90% of patients out of the hospital within the normal 2 hours with no opiates, and have zero callbacks due to pain, and a really remarkable satisfaction. So Zynrelef, in combination with just standard analgesics, Tylenol and Advil, not only substantially reduce pain, but allow patients to go home, not take home any opiates, and really not worry about having breakthrough pain. So with that, I'll turn it over to John.
Okay, well, hello everyone. My name is John Poyhonen. I'm President and Chief Commercial Officer for Heron Therapeutics. And regarding the launch, overall, we feel like it's going extremely well. If you look at it, probably most importantly, the results with Zynrelef have been really exceptional. In fact, we're seeing even better clinical results in a real-world setting than we saw in our registration trials. So that's getting orthopedic surgeons, general surgeons very excited about using the product, using it and building it into their routine regimen. From a payment standpoint, both commercial and Medicaid payers have increased their coverage outside of the surgical bundle. So that means they're reimbursing separately for Zynrelef. That's covering over 86 million lives, which is a major advantage because that's one of the limitations when you have a hospital-based product or ASC product. They're looking to see if the product gets reimbursed. We have a good number of unique ordering accounts already, and many are reordering Zynrelef. We've had very, very strong results with hospital P&T committees with Zynrelef, adding it to formularies. And we have major wins, not only in those accounts that already are using a high amount of Exparel, but importantly, those accounts that aren't using Exparel, that are using the standard of care bupivacaine. And that's important to us, Greg, because if we look at what the potential of this product is, you've got bupivacaine usage at about 15 million units a year, compared to Exparel at 1.5 million units a year. So for us to fulfill our true potential, we have to get into those non-Exparel using accounts, and that's starting off very well.
Can you walk us through in terms of how it's actually marketed and to raise awareness among the orthopedic surgeons in the marketplace, and what kind of sales force do you have operating currently?
Yeah, great question. So if we look at it, the first part of every sales call we do is really differentiate the product based on its unique mechanism of action. And that's what Barry just described there. We're the only product that has a dual product with extended release for up to 72 hours. No other product that has as broad an indication as us can make that claim, especially in a dual acting mechanism of action. Once we've established the mechanism of action, we really present the clinical data. And the clinical data, as Barry shared with you, is outstanding. We did it versus placebo, but importantly, we've beaten the active comparator consistently, and no one else in the marketplace has been able to do that. And finally, we bring it all together with the value proposition. Pricing our product as a major, branded product in the marketplace with a 22 to 28% discount over the WAC pricing of the market-leading competitor, Exparel, and a further discount in 340B hospitals, which represent about 57% of the outpatient population, is a major advantage. As far as the sales force, right now what we are targeting is about 1,300 hospitals. We have 89 sales reps that we hired and put into place to cover just the hospital market. In addition, we're targeting about 600 ambulatory surgical centers. And one major advantage that we have is that we already had an existing oncology sales force that has great experience in the buy and bill market, and they're able to cover that market segment for us.
Oh, great. Sounds excellent. And you mentioned the oncology sales force, and that leads me into my next question regarding your CINV franchise and the current product there, as well as pipeline. Can you discuss that as well?
Yeah, absolutely. So with respect to the CINV products, we're selling two. We have a 5-HT3 product, Sustol, which is a form of granisetron. That's something that we launched in late 2016, and actually has been under really a very significant generic threat for a number of years. That product, we removed the discount to reset our ASP reimbursement, and just relaunched that product at the beginning of this year. So as Barry said, last quarter it grew over 100% from a unit standpoint. So it's making good progress coming back into the market. Our other product, Cymbalta, is an NK1 product, a prepident, and that product actually has been on the market, was launched in January of 2018. Once again, in this product, it had a significant generic competitor, which we're running through the end of that right now, that generic arbitrage, if you will. And the product we expect to really be returning to growth in a significant way in 22 and 23. As far as the pipeline, while we don't have any CINV products specifically in our pipeline right now, what we do have is what Barry mentioned, HRTX 019 for PONV. And what that really is a lower dosage of Cymbalta, but it will be used for postoperative nausea and vomiting. It's used at about 25% of the dosage. And one of the things that's really exciting from a commercial standpoint is all the accounts that we're really talking to from a Zynrelef standpoint will be identical between the surgeons, the anesthesiologists, the pharmacy, with both Zynrelef and our PONV product, HRTX 019.
Oh, excellent. No, that sounds great. You can leverage that quite a bit then. You also have some pipeline in post-operative pain, though, as well. Can you discuss some of the ramifications there and the long-term horizon?
Yeah, thanks, Greg. Yeah, we have HRTX 034. 034 is kind of a next generation Zynrelef. The goal there is to get a longer duration of analgesic benefit, particularly for large bony procedures where patients tend to have pain, severe pain for longer than 3 days, and also try to enhance the pain benefit of the product. HRTX 034, we showed some preliminary data previously in a bunionectomy model where the product demonstrated very significant pain reduction at quite a low dose of bupivacaine. And so this is a 3-component combination. It definitely looks like it's working in terms of synergy, producing greater analgesic effect for the same dose of bupivacaine. But we kind of pulled the foot off the throttle in terms of 034 development when we received the unexpected indication statement for Zynrelef, we wanted to have the opportunity to meet with the FDA and discuss with them what it was going to take to get a broad label before we invested anything else in 034. We've now had that meeting, and as I mentioned, one of the exciting outcomes from our recent FDA meeting was not only being able to file the SNDA already to expand the current label, but it was reaching agreement on a package of information for a further expansion next year. And what we agreed to with the agency is to supply a relatively modest amount of pharmacokinetic data and safety data from a few additional select surgical procedures. And with that information, we would be potentially able to expand the indication statement to cover all orthopedic procedures and all soft tissue procedures. So essentially a broad label, and certainly a label that covers the 14 million target procedures that we've been discussing for 5 years in terms of where we think the market is, who would benefit the most from our product. And that's this 14 million procedures would be covered under the second SNDA that we'll be filing second half of next year. So now we have a clear pathway for a broad label. We now understand, what it takes. Wish the agency would have gotten their thinking together on this topic a little sooner, because we certainly could have generated all that data over the last 2 years. But at least happy to have the information now. And it also gives us a very clear path for HTX 034 as we decide how to move forward with that product.
We have a good indication it's becoming broader for your pain franchise. Can you talk a little bit about, I hate to be on the negative side of things, but you mentioned briefly, I think, in one of your slides, the side effect profile, and it seems pretty favorable. And obviously, the pain relief profile is excellent. Can you talk a little bit more about any side effect issues?
The remarkable thing about Zynrelef is that the side effect profile is really not distinguishable from bupivacaine alone. And so what we are able to do is to deliver bupivacaine over 3 days along with a very low dose of meloxicam, and do it in a way that results in a safety profile that essentially mimics what you get with bupivacaine, which is, as already noted, the standard of care and the most commonly used local anesthetic. And so it's with the substantial pain reduction, from our perspective, it's a very easy benefit risk assessment.
That's great. Sounds fantastic. Profile is fantastic for the product. That's all the questions I had. I appreciate your time and your responses. The presentation was excellent. Both you, John, and Barry, thank you again. And that's all I have today.
All right. Well, thank you, Greg. We appreciate the opportunity.
Thank you for joining us for this NobleCon online investor event presentation, brought to you by Channel Check and Noble Capital Markets. Visit our YouTube channel for more video content, including interviews, virtual roadshows, and conference presentation replays. New content is added regularly, so subscribe below to stay up to date. Visit channelcheck.com or click the link in the description to access equity research, news, and advanced market data on this and the 6,000 other small and microcap companies listed.